Welcome back to the Special Needs Space Bun channel. My name is Kristen and I'm going to be talking about the most common health problems in rabbits. Let me preface this by saying that I am not a veterinarian, I am not a vet tech or assistant of any kind, so take that for what you will. I just happen to have a 4-year-old rabbit that has had a few of the ailments on the list. Number 1 is dental. Did you know that rabbits have 28 teeth? Don't you find that amazing that a mouth this small, like the tip of my finger or maybe a little bit larger, has 28 teeth? And that consists of molars and what is called incisors. So incisors are the front teeth, and rabbits' teeth continue to grow. They're not like ours in that they just remain the same length. Rabbits continue to grow, and one of the main issues that rabbits can face if they are being neglected or not giving the proper diet is that their teeth will overgrow. So much to the point that they will curl, and it can become impossible for them to open their mouth to eat or drink, which can result in obviously death because they aren't able to get any of the basic needs. So if rabbits are given the proper diet, such as hay and grass and some fresh vegetables, access to chews, this can be prevented because they will naturally just wear down their teeth, and you don't have to worry about bringing them into the vet to get any sort of care in that way. But if rabbits do have overgrown teeth, as we've seen in some of these photos here, it can still be fixed in some cases by the veterinarian, where they will be able to cut the teeth and bring them back down to a regular growth. So again, just be wary of what you're feeding your rabbit. Make sure that they're eating a lot of hay, and this can be very preventable. Another thing that falls under dental is tooth spurs. So this is usually focused on their molars in the back. There's little bits of spurs that grow on their teeth, and this can cause little cuts on their tongue and on their cheeks. I mean, I'm sure we all know how much it sucks to have a cut in our mouth after we've bit our tongue. So it's similar like that for a rabbit. Their tongue scratches up on it, gets a cut, and then it can send them into GI stasis because they have this wound and pain, and it makes them not want to eat or drink, and then it becomes a larger issue to deal with down the road. So this problem can happen even in healthy rabbits, even if you feel like you're doing everything right. Rabbits can just have a preference of eating on one side. So if they're eating hay, maybe they're only chewing it on their right side or their left side, and that can create little spurs to grow. So when that does happen, and maybe you notice it because your rabbit went into GI stasis and that's what prompted you for a vet visit, the veterinarian will likely have to first view the teeth to see if it is spurs, and if it is, they'll book a appointment for the rabbit to come in and get sedated, and then they'll have to be put in this contraption here in this photo. Because rabbits have such tiny jaws, they need to sedate them and use this contraption to keep their jaws open so they have access to the teeth to be able to shave the teeth down and prevent the spurs from going any bigger and causing any more pain to the rabbit. Unfortunately, this can continue happening throughout their lifetime, and it can set you back a few $100s each time it happens. Third thing that falls under dental work is tooth abscess. This means there's like a wall of pocket, usually located in a root of a tooth or near the bone, and it has a pocket of pus, which just indicates that there is an infection and bacteria growing in the area, which can be lethal to your rabbit. And so your rabbit will likely need antibiotics, and a lot of the times they may even need surgery and sedation to be able to remove the abscess so that your rabbit has the best potential of recovering from the abscess and the infection if it's not reacting to the antibiotics. But again, I'm no doctor on what actually will happen with this. I don't have any experience with this part, but it can be a common issue, and usually to find out how serious it is, you may need to pay for an x-ray and or an MRI to see the extent of the abscess before they do any sort of surgery. Yeah, a lot of the time people aren't able to pursue the surgery because of the location or financial restraints. So, like rabbits' teeth, their nails also grow, and you have to maintain cutting them every month, especially their back paws. So rabbits have what is called a quick, just like dogs, and it has a nerve and blood supply within their nail, and so you need to avoid cutting this. But when rabbits have overgrown nails, the quick in the back paws specifically will continue to grow with the nail, and so you're at more risk when you do decide to cut your rabbit's nails of cutting the blood supply and cutting that quick, and in result I've heard that it's not that painful for them, but ultimately we just never know. I think it just looks very visually disturbing because you've just made your rabbit bleed by letting the nails grow out too far. And it also makes it difficult for them to dig and walk if they do get too long. So just make sure you're on top of it. Rabbits hate getting their nails trimmed, so worst case scenario, just bring it to your vet or get your vet to show you how to properly cut their nails and what to look for and how to prevent this injury from happening. And blockages as a result of the hairballs. So rabbits have molting seasons where they shed their whole coat. Sometimes this happens all at once or over a period of time where different parts of their body will lose a significant amount of fur. So again, as a pet owner, you need to be really on top of shedding or like brushing your rabbit, and to ensure that it won't consume major chunks of its own fur, because it can create a blockage in its GI tract. This means that its normal food and water won't be able to pass through, and it can send your rabbit into a screeching halt within its GI tract, also again known as GI stasis. So your rabbit will become anorexic and not be able to eat or poop or drink and all of the basic functions that it needs to. And it can become very serious and may require surgery to remove the blockage, which is something that all pet owners obviously want to avoid. In the case of this happening, you would need to get an x-ray to see where the blockage is, what it is. Maybe there are other methods that they are able to break down the blockage without having to intervene with surgery. But yes, it can be very dangerous and set you back anywhere from $1,500 to $2,000, possibly more, depending on what that care is going to be like after the surgery, if it was required. Emergency vet situations like this are a pretty penny, that's for sure. Is GI stasis. You may have heard me mention GI stasis a handful of times in this video already. That is because it is a very common health issue with rabbits that is specific to rabbits, and it is incredibly deadly. This is one of those illnesses that time is of the essence. If you have any concerns that your rabbit has GI stasis, you need to rush them to the vet immediately. Take off work, stop what you're doing, make an appointment, call your vet. If you're at a rabbit savvy vet, they'll understand the importance of this, and they will make room in their schedule to bring your rabbit in and have your rabbit reviewed. Especially if this happens at night, you want to have a secondary vet available, like an ER, because this could happen at any point in time, and you just need to be prepared to bring your rabbit in a hurry, because the sooner the better recovery for them. So some of the symptoms are basically your rabbit becomes anorexic. So GI stasis is a secondary illness, meaning there's something else that is bothering your rabbit and creating pain. Like I mentioned, tooth spurs, the cuts in the mouth, that can make your rabbit not want to eat, which sends them into GI stasis. And so your vet is going to have to do a little bit of tests trying to figure out maybe what the cause could be, but their main focus is treating the GI stasis first, and then they'll discuss with you what may have caused it so that they can prevent it in the future and or treat the actual issue that is creating the GI stasis. So again, the symptoms are basically your rabbit is going to be essentially anorexic. They're not going to want to drink water. They're not going to want to eat. Even if you present them with any sort of food, parsley, herbs, hay, you know it's really bad if they turn down treats like banana, any sort of like favorite snacks. If they don't accept that from you, that is a major red flag. And what you should do next is go look at their water bowl and see the last time that you think that they've drank. You're going to want to keep an eye on these things and know what is normal for your rabbit. And if you left breakfast out and they didn't eat it and now it's 5 p.m., you're in a very dangerous territory where you will need to go to the doctor and test to see whether or not they're in GI stasis, because these are main factors of them being in GI stasis. And unfortunately, a lot of pet owners don't know the signs, and then they wake up and the rabbit has passed away. And it's just really unfortunate that it is such a quick illness that can have them deteriorate within 24 to 48 hours. So if your rabbit is hunched and hiding, not acting normal, like it's not coming out to greet you, not eating, it's because they have built up gas in their tummies and then it's causing them pain because they don't have a way of releasing that. Basically, rabbits have a GI tract similar to horses where they need to be constantly eating, constantly pooping throughout the day. They need access to hay all day long. And so if they don't have this, their GI system stops working, and when you bring them to the vet, your doctor is going to likely give them IV fluids because they're likely going to be dehydrated, and since they're not consuming any water. And so another thing that they're going to do is give them motility drugs. This is going to get their GI system moving a little bit, trying to pass the stool that it needs to. And if it's, depending on how serious it is, you may need to do inpatient care, where they monitor your rabbit overnight, and they might have to take x-rays and see where the gas is, see if there's a blockage even. There's going to be a lot of tests to figure out what could be the issue if you don't know what the cause is. And so they're also going to give you a bag of critical care, which is around $25-$30. You're going to need to follow the instructions on that to create this liquid paste that you're going to have to feed your rabbit with a syringe to ensure they're getting water and nutrition that they're not obtaining because they're not eating. And so this is going to require days of monitoring your rabbit. Sometimes you may need to take off multiple days of work. Hopefully you have someone that can assist you with that, because it's very crucial that you focus your attention on your rabbit and make sure that they are drinking and eating, because if they aren't, you need to rush them back to the vet and tell them that what they did the first time didn't work and they need more medicine, and or need to be taken to inpatient care and hospitalized, because outpatient care isn't working for them because it's too serious it's at the serious stage of the illness. And so I hope this information helps you. My rabbit has gone into GI stasis 2 times for sure, 3 times, but he wasn't that bad the 3rd time, and that was because it was tooth spurs. So these things can come on so suddenly, even in a healthy rabbit. This is why it's so important to go for regular vet checkups every 6 months, and that way you can prevent these things from happening within reason. Of course, there's still emergencies, there's still going to be issues, so just remember, time is of the essence, and make sure you monitor your rabbit for these symptoms. Bladder sludge. This is way less serious than the ones that we've already talked about. It just means that your rabbit is getting too much calcium in their diet. You may notice that your rabbit has like a cloud, chalky-like texture to their urine. It might be mixed, so you might have like a bit of the normal urine, and then there's this like, it's white and chalky. And I've only noticed this just because he'll pee on the floor, and you'll actually be able to visually see it instead of it being in the litter. It might be harder to identify if they are regularly going in the litter. So this just means you need to reduce foods like spinach and leafy greens that are really dark, kale, parsley, those types of things. Honestly, when this happens, it's best to just like remove those fresh veggies from their diet for a day or two, so that it makes them eat hay and gets them back on track. Because if your rabbit is presented with vegetables, they're gonna take the vegetables over their hay any day. So yeah, just make sure that they're eating their hay, and keep an eye on it. If it gets worse or if it continues for a couple days, definitely call your vet. But this doesn't typically need you to rush to the vet for this. You can intervene yourself, but it is alarming the first time you see it, so just wanted to throw that one in here. There's probably way more parasites than I'm going to list. I'm just going to talk about the two most common ones that I have seen and know a little bit about. But the number one is ear mites. So ear mites will get into the rabbit's ears and cause them itching so much so that it can create wounds and irritation of the inner ear, and they'll scratch and shake their head. It can look pretty gross, and definitely needs your vet intervention with medicine. So the second one is Cuniculi. This is a parasite that can cause neurological and renal disease in rabbits. You're gonna have to do a lot of testing with your vet if they suspect that this is the issue. Again, this is one of those things that you need to find it quickly before the symptoms escalate. You'll probably remember seeing rabbits that have a tilted head, and oftentimes this is a permanent thing for them. They can live happy lives like this. It's not like they need to be euthanized, but it is preventable if this is caught early. This is just one of those things where it can also cause damage to their kidneys, and it can migrate to their eyes and cause cataracts. That may be why you notice like this white film over their eyes as well. And if it travels to the brain, it can cause convulsions and seizures, and limb paralysis, tremors, all that kind of stuff. So it's a really serious parasite and disease, and they are able to provide medicine, and usually they're actually like, if your vet suspects this happening, they're going to take a blood sample and send it to a place to get it tested. If you're in Canada, specifically Vancouver, this test is around $400, and they need to send it to the States because we don't have a facility to be able to test it here for whatever reason. It is quite expensive, and you'll be able to determine if it comes back positive or negative, and they like to do that test before they actually put them on the medicine, because this medicine, I believe, is hard on the liver, so it's good to just like not treat it unless they know for sure that they have it. But again, that will just depend on your vet and what you guys decide for your rabbit. So just like you and I, rabbits get ear infections, especially if they are the type of rabbit that have lop ears. So this just means that they don't have like their ear cavity out in the open getting good air circulation for whatever reason. They're prone to ear infections. So the ear infection can be really deep in the drum, and usually if you suspect it, it's your rabbit will be shaking their head a lot and itching, and they may even lose their balance and fall over. It can be in one ear or both ears at the same time. It can happen frequently throughout their life. My rabbit has had 3 ear infections, I think maybe 4, I'd have to go back and count, and he's only 4 years old, but he is a Holland Lop. And so your vet will look into your rabbit's ear and see if it can identify any infection, so like pus-like fluid. They may see it on the eardrum where it is too deep to actually touch to get a culture of the bacteria, which is unfortunate because vets like to get the culture to test what kind of bacteria it is, so then they know what kind of antibiotics to put your rabbit on. They can just put your rabbit on antibiotics, but it may not cure it because they could be using the wrong antibiotics. And so sometimes it's good to just kind of wait, see how the symptoms are presenting themselves, if it's getting worse, if it's getting better. Sometimes rabbits just naturally have that kind of fluid in their ear, so it can be hard to tell unless they are able to test it, or if your rabbit is exhibiting a lot of like irritation in the ear by itching and shaking a lot, then it likely is an ear infection. And so this can take a month or longer to treat. Usually they will give like I said, antibiotics and eardrops. So the eardrops are like used by cat eye drops, I believe, and so that's the worst part about it. Your rabbit is going to become very hostile because they don't like feeling little drops trickling down the eardrums. It itches them and tickles them, and they'll run and hide. So medicating for an ear infection is honestly a nightmare as a pet owner. And also, so I mentioned, so basically it's eardrops, antibiotics, and probiotics. And sometimes there is a medicine that might cause ulcers for rabbits. So just keep an eye on that. Check out my other video that I spoke about on ear infections so that you can prevent that, hopefully. And basically, if it goes untreated, it can have a long-lasting impact. In rare circumstances, you may need an MRI or an X-ray, specifically an MRI, but those are $1,500 here in Canada. So they want to see how deep the infection goes, whether or not it is connected to their brain at all, any inflammation, because especially if they're presenting symptoms of convulsions and seizures, like our rabbit did. So we suspect it is quite possible that his ear infection went on for too long, and then he developed this form of epilepsy. So this is a very rare occurrence, and not something that you probably need to be worried about, but definitely something that can happen. Rabbit hemorrhagic disease, which is a virus that was going around. If you live in North America, specifically Canada, you may have heard of this, especially if you're a rabbit owner, because I think we're all panicking when we found out that this virus has landed in Canada and was vets were seeing a really big increase in rabbits contracting this. And so this is a very deadly and serious issue, so much so that there's actually an RHDV virus vaccine, I mean. And so if you're a rabbit owner when this happened, maybe like a couple of years ago, a year, you're probably also in line to get this vaccination for your little rabbit. And basically some of the symptoms are, it's extremely contagious, and basically some of the symptoms include loss of appetite, fever, bleeding from the nose, mouth, and rectum, and seizures, as well as sudden death. It's really not good for rabbits. Can't stress that anymore, but I think that if you have a rabbit, just ask your vet if they have a vaccine in their facility, and then you just don't have to worry about it. I think it's something that wild rabbits get a lot more because they're outdoors and they can spread it amongst each other. I think it's spread through inhalation and ingestion. So, and if a rabbit was exposed to it, and if you say you're doing like a bunny speed dating or something and a rabbit had it, your rabbit would be more likely to get it. So it really is best to just get the vaccine and pray that your bunny doesn't get it. Feel free to comment down below if there is any that I missed and any popular ones that should be on all of our radars. Thank you for watching, and if you have been watching the channel for a while now, just know that Astro is doing really well. He has had an ear infection recently, which he has recovered from since. We still need to do one more vet checkup just to make sure, but he hasn't had any seizures since December, which is absolutely amazing. We're still medicating him 3 times a day though, and we haven't had a conversation about whether or not we want to start weaning him off his medication, because in the past when we've done missed a dose, he has had a seizure very soon after. So we just think that he's on a roll and he's doing really well, and we don't want to interrupt that. So again, thanks for watching.